Tourette's podcast is not a medical advice show. It's a show about experiences. In the course of that, we may talk about medications or therapies or stories from the doctor's office, but don't mistake any of that for medical advice or direction. It's not. Get that only from people or places licensed or certified to give it, not from a massively fun and action-packed podcast about our life experiences, such as...
He's going through the same thing as a lot of other now successful adults that you've interviewed on your show that, have learned how to cope and have become stronger for it and use it as a tool to help them in life.
This is Tourette's podcast. I'm Ben Brown. Hey, different microphone this week. Got a listener question here that came in a couple weeks ago, but there's been a little development that kind of relates to this question here. I'm just going to read a little portion of it. It says here, "Hello, Ben. I've heard you talk about your past experiences with medications, and it comes up with your guests too, and it seems like a lot of you had bad experiences and stopped because of that. At this point, what are your views on medication for Tourette's?" End quote. So just real quick on that. I don't have firm views either way about medication. If you feel like you need them for yourself, then cool. You know yourself better than I do. Your doctor knows you better than I do. And I have nothing to weigh in on with that. If you don't need medication or don't want it or just have a firm stance against it, then, or maybe you prefer to live your life your own way, same thing. That's you. I'm not opposed if that's the right decision for yourself. It just applies in so many different ways. And of course, a lot of people are exploring things like comprehensive behavioral intervention for tics, or CBIT, as a way of managing that aspect of TS. But I didn't bring this up just to be evasive or have no answer to this question, because it is a fair question, but it's also one of the reasons why we have that disclaimer at the front of the show, because I'm no doctor. My college major was English. And the conversation about whether meds are right for you are between you, and your doctor. I just like to ask our guests on this show about what they've tried and what the context of that trial was. Here's the update, though, and why I bring it up today. It used to be that medication was a sort of frontline conversation with treating TS. But the American Academy of Neurology just came out with a new guideline for treating Tourette Syndrome. Shout out to Dr. Christine Canalia for helping me to make sure I knew what I was talking about before I attempted to explain and break it all down here. But the American Academy of Neurology, or AAN, published a new guideline in the medical journal Neurology, which is AAN's journal. Published this guideline that basically moves medication farther back from the front line. When it comes to what doctors recommend, I'm just going to read an excerpt here from the press release about it. Quote, "For the guideline, authors reviewed all available evidence. They recommend that when a person has tics that are not causing physical impairment, pain, emotional distress, or social embarrassment, that watching and waiting is an acceptable management strategy when also combined with providing education that helps the person better understand and cope with the disorder. Treatment must be individualized and based on a collaborative decision among the patient, their caregivers, and their doctor. The guideline also recommends that doctors tell children with tics and their caregivers that there is a good chance that their symptoms will improve in late adolescence. If symptoms affect a person's daily life, the guideline recommends that doctors first consider prescribing a treatment called Comprehensive Behavioral Intervention for Tics, or CBIT. CBIT combines relaxation training, habit reversal training, and behavioral therapy to help reduce tic symptoms. The guideline states that CBIT is effective in both children and adults and has no major side effects." End quote. So to recap the recommendation to doctors, instead of meds, try CBIT first. That's what they're saying now at AAN, American Academy of Neurology. Of course, a persisting thought here kind of stems from a recent listener question we had on a past episode. I guess it was kind of more of a comment from an adult with TS who couldn't find anyone to administer CBIT on her because the doctors she went to said they just did CBIT for kids. So that's got to be ironed out. And if that's inaccurate and it's way more accessible than I'm aware, then maybe there's an awareness issue. By the way, Tourette Awareness Month right around the corner, May 15th through June 15th. Head to tourette.org, among other places, to get info and ideas on how you can help with awareness. But I have heard from a number of adults that they can't find CBIT in their area at all for kids or adults. But I think that's got to be changing at some rate. I'll reference the upcoming summit we've been talking about, the Treating Tourette Together Summit, August 17th and 18th in Minneapolis, Minnesota, in the United States. And CBIT is a central focus of that. Adults heavily involved too. treatingtourettetogether.org for more information on that. But this is development. This is progress. And Hopefully this leads to more access to treatment for the people who need it. According to the science folks I know, the authors of this new guideline did a really great job supporting their case that CBIT is the first thing to try before meds. But I am glad that I asked Dr. Canalia to help me digest this report because she pointed out a couple things, a couple other takeaways that I might have missed or spent less time with. One of them is that people who exhibit tics should be evaluated for other things like ADHD, OCD, and mood or anxiety disorders, self-harm components, and so on. Things that we sometimes see or maybe even often see come along with TS. That's in the guideline. And the third breakout is a warning about the use of cannabis to treat TS. And this is interesting because this is something a lot of people have been talking about. And I get a lot of questions over email as to whether cannabis is effective for treating tics. So quoting directly from the press release here, says, the guideline mentions that some adults with Tourette syndrome treat their tics on their own by using cannabis or marijuana. Because there are risks of using cannabis, the guideline recommends that a person's doctor directs them to a doctor who can supervise their use of cannabis for treatment of tics, and only in states where cannabis is legal. End quote. So that's the AAN saying, basically, we don't have evidence solid enough to say that we can support cannabis as a way forward in adults. And well, yeah, not with kids either. But this is consensus. That's what makes this part pretty important. Because I don't know if there's a whole lot of published consensus before, at least not with the AAN. Anyway, I'll link to the materials in the show notes with this episode at tourettespodcast.libsyn.com. And of course, we'll also have them in the Tourette's Podcast discussion group as well on Facebook. Thanks to our admin, Sophia, who keeps everything running there. Give me your thoughts on this guideline. If you've read through it, have any concerns, objections, total agreement, whatever, let me know. I'll also link to a TV news spot that discusses this guideline. Big thanks to our latest supporter, Esther, who went to patreon.com/Tourette's Podcast to back the show and help it live, cover some of the costs, and show solidarity. If you'd like to become a patron of the show, which you can do for yourself, you can do it in dedication to somebody else if you want to, then head to patreon.com/Tourette's Podcast. And also let me know if it's okay if I can thank you on the show publicly. I want to do that for each supporter. I respect it if you want to be anonymous. I'd love to thank you publicly. You can reach me at tourettespodcast@gmail.com. If you have any questions about it, thank you. People say this podcast helps them, so I'm doubly grateful for any bit of support that comes in. Reminder for your 2019 calendars, this is more for our Canadian listeners. Tourette Canada has its annual national conference ahead, October 17 and 18, so it's a little bit down the line, but it's good to start thinking about these things now if you want to make arrangements to attend. It'll be in Winnipeg, and thanks to Ramona at Tourette Canada for pointing this out to me, there will be a CBIT training component to the conference. Also sounds like they got some awesome speakers on the agenda, and we'll keep filtering out information about the conference. Again, in Winnipeg, October 17th and 18th, head to tourette.ca for more info. All right, so I don't want to make this intro too long. There was some stuff in the discussion group I wanted to get to, including some responses to my inquiry about empathy pain or sympathy pain. Whatever you want to call it, because I don't know either, but please join the discussion group on Facebook. There's so much good stuff there and opportunities to learn, ask questions, share experiences, say what's on your mind with regard to TS. It's awesome. I learn a lot from it, including that other people out there definitely have this empathy pain thing or some variation on mirror touch synesthesia, which we talked about last week. We're also about to hit another milestone in membership of the discussion group, the head count there, which I'm super excited about. All right. Different kind of episode this week. Let's get to it. This is only our second episode featuring a non-adult, otherwise in this case known as a young man named Liam, but also his mother, Sarah. We all talk about it, about TS, about Liam's experiences, about the parenting experiences, dynamics around the house, school, and it was so great to connect with them and talk because we've been emailing together since I think season 1. Really glad they're here. This is me talking with Liam and his mother, Sarah. So yeah, you can just start by telling us what your name is, and also if you want to tell us what state you're from.
My name's Liam. I live in Arizona.
And how old are you?
I'm 13.
13. So is that 8th grade, or are you in 9th grade yet?
I'm in 8th grade.
Okay. So 9th grade's coming up. I really clearly remember going into 9th grade. I remember the bus ride. I remember my homeroom. I even remember the clothes I wore. This gigantic set of jean shorts and a shirt from a band called The Cramps, and that shirt was about 4 sizes too big for me. also because it was 1994, and that's kind of what people wore back then. So what are you looking forward to in high school? And so it's February. When do you wrap up with eighth grade?
We have the summers off. In ninth grade, we're looking forward to like all the cool classes.
What do you have a particular subject you're into? A lot of the people I talk with who have Tourette syndrome are kind of on the creative side of the brain. They like art. They like, writing and language, and some go in the math direction, which I was never good at. But what do you like to do in school?
Um, Math. That's pretty much all it.
Nice, nice. One of my other guests on one of the previous episodes, she said she had something called dyscalculia, and I kind of feel like I have that too, to where I'm so bad with numbers. I think I'm good with language, good with writing, and sort of creative stuff, but math is something I was just never able to really do much with. Has that always been the case with you, that you've been good at math?
Yeah, I've always been good at math.
Nice. Is that something you want to take somewhere in terms of a career, or have you thought of that kind of thing?
Yes, like maybe engineering.
Oh, nice, nice. That's what my dad. He's retired now, but he was a civil engineer. So is it the kind of thing where your teachers are sort of recognizing the talent that you have with math, and are they encouraging you to kind of go into engineering, or?
I have STEM and math. They think they know I'm smart. My English teacher, I don't know if she thinks I'm that good.
Well, I guarantee you my math teacher didn't think I was that good. But yeah, I'd love to just kind of talk about the history you have with Tourette syndrome and kind of how you're dealing with it. And, we could talk about how I remember dealing with it when I was your age too. But I definitely want to get your mother introduced. Do you want to pass the phone to her, and then we can talk to her for a minute?
Okay.
My name is Sarah Ritchie. I'm Liam's mom. We live in Gilbert, Arizona.
So with Liam, tell me again when the diagnosis was, and I guess kind of what was orbiting that happening, and was it something that kind of set on quickly before the diagnosis, or were there things that you kind of noticed over the years, or set the stage?
Yeah, it was a sudden onset, and it was a strange coincidence, or there was all these things that happened to him right in that time frame, and it made me research pandas a lot because
Yeah.
Liam had an unexplained blackout while he was walking with his first grade class from the classroom to another part of the school, and his first grade teacher saw him wobble and about to face plant into a post as they were walking,
Huh.
snatched him up as he blacked out and ran him to the office. And there's a fire station right next to the elementary school, so
Yeah.
the EMTs got there really quickly. He was awake, and we took him to the children's hospital because I was home and I got there within like 15 minutes.
Yeah.
And he was there for a while. His heart rate wouldn't regulate. They kept him there for actually a couple of nights because they checked a lot of things out and they just couldn't figure out what it was. And his heart rate was just so high, it was unexplained. So he had all kinds of scans to rule out seizures, all sorts of things. And they found nothing. Eventually, we went home. And it was the next week he had an infection, like an impetigo, facial infection that was probably, they assumed, possibly picked up in the hospital. Got antibiotics, that went away. And then the next week after that, I picked him up from school and I saw in the rearview mirror in the back seat, he has a sudden grimace, tongue protruding from the mouth, motion that he's doing repetitively.
Yeah.
And it was intense, and it was boom, that day, all of a sudden it was there. And there were no other visible tics prior to that.
Wow. So prior to just previous to the blackout, did you guys try to locate any sort of environmental things that happened, or anything maybe traumatic that he had seen, and or just
They theorized that maybe he just had a virus because he had a little bit of like a stomach bug
yeah.
symptom at the same time, and that maybe it was just related to that. We never were able to get a clear answer on why it happened.
Huh.
And there was, he was a happy kid in the class. There was no trauma, but and then that was at age 6,
Yeah.
and that the sudden onset tic happened, and then they just morphed constantly. They changed. By the end of that summer, he had asked, we'd been seeing a neurologist that had actually read his brain scans from the hospital. And we started seeing her as soon as the tics happened. And she oversaw his care of the tic issues until we moved up here. And there was never really a diagnosis. There were theories. It could just be tics. A lot of kids start with it. Often they grow out of it, was the explanation we were given.
Yeah.
And about 6 months prior to moving up to the Phoenix area, I started going to a specialty developmental behavioral pediatrician clinic in North Scottsdale. And she seemed to have a more well-rounded view of Tourette's patients, of kids with tics. She seemed to see a lot more of this and have years of experience of dealing with it. And within the year, she said, of us moving up here, she said, I'm comfortable diagnosing as Tourette's. There were occasional breathing and occasional sound tics that would come out. And as soon as I got that diagnosis, it just opened up a whole new world. And then we started to see, looking back, the comorbidities of Tourette's, the OCD, the ODD, all these other things that we saw prior to the tics from his toddlerhood and from, being a baby, like sensory sensitivity, things that he would do repetitively as a baby and as a toddler that all kind of came into the clearer picture as the whole package.
Yeah.
After the diagnosis a year ago.
Okay. So from sort of first signs to diagnosis, it's a few years, if I'm following right.
6 years.
6 years.
Yeah. He was 6, and then he was, I think, 12 when he was diagnosed finally.
So what were the marching orders for him at that point after the diagnosis?
The diagnosis just really helped. I think Liam's reaction initially was he was upset, but he didn't really say anything until dinner that night, where he said, "Great, I have Tourette's. That means it's never going to go away. It means it's permanent. It means I have this for life." And we said, "Well, no, it's not necessarily true."
Mm-hmm.
And we really had a very limited view of what it was. And he'd been trying different medications since age 7 to try to manage tics and ADHD symptoms as well.
Yeah.
And once we got the Tourette's diagnosis, it didn't change the way the doctor managed his care. It just changed our educational experience tremendously, because then we understood so much more. And then finding your podcast, and then much later on the show Raising Tourette's.
Yeah.
Actually seeing families like ours, just, your mind explodes. You're like, oh my gosh, we're not alone. We're not so, different from everyone else. These families are having the same struggles that we are, and these kids are struggling with the same things socially in school that Liam does. And you didn't feel alone anymore as a parent, and I think Liam as well.
That's amazing. So just kind of having or finding the associations and the commonalities, and so did he kind of see himself in the representations that he saw on TV?
Definitely, he could relate to a lot of them. Of, oh, I experienced this, or, oh, I have the same tic.
Yeah.
And I saw in a lot of the parents some of the same struggles that I deal with.
I bet, yeah.
Where one parent thinks you can just, discipline it out of the person, out of the child, and the other one that says, no, this is a cycle. We kind of have to let it, burn out, and just kind of step back and let him take a deep breath before he can get control.
Yeah.
Yeah. I think that made a big difference. I want to get him involved and be able to introduce him to other kids and do the groups that,
yeah.
There's a couple of Tourette's groups up here, and there's one that tries to do meetups, but often so far we haven't been able to make it to one.
Okay. So, and do you know if those meetups have, and you may have to reiterate if you said this, but other kids his age, or I know sometimes the meetups are sometimes, parents who just kind of go alone to kind of feel it out and figure out what they need to take home to, I guess what I'm saying is, like, sometimes you you hear about people saying that, and this comes up in the research, that, if you have Tourette's, then you're around other people who have Tourette syndrome. Sometimes the ticking will kind of flare up. And my personal sort of thing about that is that, sure, but that's kind of a short-term thing. There could be amazing long-term benefits from just kind of, finding commonalities and, kind of gaining the confidence and the friendships that you make. And
Exactly. No, I'm trying to figure out how to save up money to send him to Tourette's camp in the Chicago area this summer.
yeah,
And I asked him, I said, if we could figure out a way to afford it, would you want to go? And he said, absolutely.
yeah.
He just doesn't want to fly out there alone. But
Yeah, I
no,
hear that. Yeah.
from my understanding, what your question was about the groups, it does seem to be a mix of adults with Tourette's and families. I don't get the impression that they have a really great attendance. It doesn't seem like they're really well attended meetups, but when they do, it seems like there's a mix. And I didn't get the impression that parents go without their children, and I certainly wouldn't. I understand the risk of that. I understand the sort of like, how yawns are contagious, that the tics can be too. But no, I think getting Liam exposed to other people like him and other kids like him would be a huge benefit, and that any sort of side effect of that would be temporary and totally worth it.
Well, yeah, I'd love to talk with him for a minute about what he's seen in the portrayals and what he's found to relate to and all that, if that's okay.
Yeah, absolutely.
Hey, Liam, can you hear me?
Yeah, I can hear you.
So your mom and I were just talking about seeing shows like Raising Tourette's on TV and kind of listening to people on the podcast. What did you see in that show or hear on the podcast that you related to? Just things that you kind of saw yourself in?
Some of the mean kids. So I've seen that happen.
Are you talking about seeing instances of kids kind of mistreating other kids who deal with Tourette syndrome?
Yes.
Is that something that you've had to deal with? Or, with me, I mean, that definitely happened to me when I was younger. And it took a bit to kind of convince the kids around me that I just had these things I couldn't control. Do you ever try to explain that?
Doesn't really work.
Yeah. I mean, it can take a bit. It can take a bit for it to click with someone to where they can see that, there are things in their lives that they can't control either. So seeing these representations on TV, I mean, what were your thoughts? Just kind of watching that and kind of seeing things that you could connect with.
I saw it and I realized my Tourette's isn't that bad compared to some of those people.
What are your tics? Like, what do you do? Are they vocal tics and sort of bodily movement tics, or?
I do a pretty painful head shaking thing.
Yeah.
A lot of sniffing and stuff like that.
Yeah, I don't do the sniffing one so much anymore. I definitely used to, and I have a head jerking tic that can be kind of painful because I strain my neck muscles when I'm doing it.
I just shake it from side to side.
Oh, okay.
It just headaches sometimes.
Yeah. So is that one of your main tics, or do you have others in there?
I have a lot, but that's one I hate the most.
Yeah, I hear that. When you're at school, for example, do people have, we talk about bullies and all that, but do people just genuinely have questions for you, and they see you tic and they just kind of want to know what's happening?
Sometimes they have questions. The only person I know who hasn't asked a question, like, he's missing a leg and stuff, so he kind of just is like, okay, I don't really care.
Right. Yeah. I mean, do you find that people don't really care as much after you explain what it is? I know not everybody's going to be like that, but do you find that more often than not people are kind of understanding about it?
Well, a couple of people are understanding, but most of them, it's like, could you stop that? It's annoying. I tell them, oh, you think it's annoying?
Yeah, I definitely got that. Even, I don't know, I remember, this is probably later on in my 20s, but I definitely, one of my first girlfriends, she got really annoyed by my tics. And I remember at one point she just said, like, what are you doing? Like, knock it off, like, stop it. And it was the kind of thing where even if you do explain it, sometimes people just kind of have their own perceptions of what's happening and what you can do about it. And it takes people a minute to learn that, there are things kind of beyond their immediate comprehension. But one thing I think that kind of helps with is just the fact that you're able to kind of better relate to what other people are going through in their lives. If they are dealing with something difficult, something that they might be embarrassed by, having Tourette syndrome, at least for me, I think makes it easier for me to empathize with them and, kind of cut them some slack and give them some room to kind of live their life and figure out what they need to do. And do you also have a core group of friends who they know your tics and they understand you and they're not really bothered by it?
Yeah, I have a friend named Jaden, and I feel like he knows someone who has Tourette's.
Yeah.
And I have a couple other friends who, they're okay with it.
Have you ever talked with other people who have Tourette syndrome?
No.
I didn't get to do too much. I did a little bit of that when I was younger. I had a pen pal. We traded baseball cards in the mail. He lived in Ohio, and we went to visit him one time. I would go to conferences occasionally. But after that, I think once I turned maybe 13 or 14, I never talked with anybody else who had Tourette syndrome until last year, which is kind of unbelievable because the amount of people I've connected with who do have Tourette syndrome and who I get to talk to and who get to tell me about their life experiences has totally changed my life and has made the whole thing so much better and easier for me. I'm 38 years old, and I used to just not tell anybody that I had it. Some people could tell. They saw my tics and they would ask questions and all of that. Sometimes I would answer it depending on who they were. But it took me a long time to kind of reach out and talk to other people with Tourette syndrome like yourself. And it makes me feel so much better, just the process of doing that or hearing from other people who have Tourette syndrome. Knowing that you're not isolated, knowing that there are other people out there like you. Does it kind of help you understand your own Tourette syndrome a little bit better?
Yeah, it lets me know that I'm not weird. Like, there are a bunch of other people.
Yeah, exactly. I mean, I don't necessarily see anybody as weird anymore, just because I'm very conscious of myself and how I come off. And if someone's, let's just say, for example, I'm talking with somebody at work, they have no idea I have Tourette syndrome, but I'm blinking really hard or my head is shaking or something. It's just, I make room for basically everybody else and everything they have going on. I find that it just helps me relate to people better in general because I can empathize with any flaws or shortcomings they may have. And at that point, they just don't bother me anymore. I think it's a really cool approach to life. And I think it kind of leaves you with more of an open mind. And again, so it's been about a year, right, since your diagnosis?
Yeah.
How have things changed for you?
Oh, it's gotten a lot worse since I was 6.
Your tics have gotten worse?
Yeah.
Do you remember some of your early tics from when you were maybe 6 or 7, or do you remember what you were doing?
I would lick my top lip, and then it would start dissolving my face, and it would hurt a lot.
Oh yeah, so it would be kind of like a kind of like chapped lips, but sort of like under your nose.
Yeah.
Yeah, I did the exact same thing. Well, so I had the opposite of that actually. It wasn't below my nose or like sort of above my lips. It was below my bottom lip. I would take my tongue and I would just kind of this sounds really weird, but I would just kind of lick the bottom part of my own face. And I would do that so profusely that it would leave this sort of red rash to where I basically had this Ronald McDonald looking mouth thing. And I think kids even called me Ronald McDonald, if I remember that right. But overall, do you think you have, are you developing more tics? And have you thought of ways to kind of deal with them outside of medication? Some people have different kind of exercises or things they'll do to help.
I just do medication.
Is it helping you? Are you ticking less or do you feel better about it? Or
I feel like it's working a little bit.
Your observations about sort of where the medications have gotten them, do they seem to be having an impact? I mean, sometimes it's kind of hard to tell just because Tourette's fluctuates so much, but what are you seeing?
Right. Well, we're on the umpteenth drug to try so far.
Yeah.
Just introduced Abilify an extremely low dose a week ago today.
Okay.
And I asked at the appointment 2 weeks ago when we last saw her, when she discussed starting this, how common it is in her experience of requiring this many tries of different medications to find something that works to manage tics for a patient with Tourette's.
Yeah.
And there was a long pause. And then she said, Liam's one of my very most challenging. She said, it usually doesn't take this much. It usually doesn't take this many tries to find something that works. And it's been really difficult with him because, the last one that we were on, which was clonidine, it worked great for about 2 months max, maybe, before it just quit.
Okay.
And it was just done. It had a very, very brief window of effectiveness, and then it was done and over with.
So have you guys had thoughts about if this sort of trend continues and medications don't really seem to be having too much of a meaningful difference? Have you thought of other ways of maybe trying to manage or, CBIT or...
We'd love to try CBIT.
Yeah.
I don't believe that the insurance covers it. And the specialist that he goes to, she wasn't even convinced that there was anyone in the area that does it.
Yeah.
It would be great. I would love to try to get it for him. But from what I understand, it's very challenging. We'll try anything. I read and talked to so many parents that swore that CBD oil helped their kids. And in Arizona, there's the dispensaries, which have medical marijuana. And then there's the over-the-counter, as long as you're an adult, you can go in and buy the CBD products, which are like nutritional supplements with 0 THC.
Yeah, yeah.
So we tried that. Nothing, absolutely nothing. And she said that was her experience with most of her patients as well when we mentioned it to the doctor.
What's the sort of tough nut to crack? Anything specific, or is it just that tics seem to be kind of increasing in severity? And I know, being 13 years old, it's kind of a vulnerable, time in life, and there's a lot of changes happening, and so it's kind of hard to find really much sense of consistency. At least it was with me, just because I was all over the place. But
junior high sucks no matter who you are or what you're faced with as far as challenges go. I mean, any kid suffers the plight of, the onset of puberty in 7th and 8th grade are just a horribly challenging time in life. Add to that something that makes you stand out and, audible sounds during class that disrupt class occasionally, or just, the kids will pick on anyone and everyone for everything possible.
Yeah.
And it's just, it's a easy target. And I think it just makes it even harder socially. And it breaks my heart that I can't, protect my child from that. But I honestly think it's made him stronger. I think I've seen such a huge change in him in the last year, through diagnosis, through education, and hearing about everyone else that has Tourette's, and that he's not unique in that regard, that there's a lot of people out there and it's really common, more common than we ever thought. And that, he's going through the same thing as a lot of other now successful adults that you've interviewed on your show that, have learned how to cope and have become stronger for it, and sometimes embrace it positively, and use it as a tool to help them in life and other challenges that you face in life. I think that's made a huge difference for him. And he's become a lot more confident. He's come out of his shell. His teachers this year, it was a completely different meeting with them this year than in previous years, where everyone was happy to hear this kid had opened up, especially the teachers that he'd had previously in last year's classes, that he's come out of his shell. He participates in class and cracks jokes, and everyone knows how funny and smart he is now. And he's seems to have had an easier time making friends this year, because of that increase in confidence.
And so that increase in confidence, so you can attribute at least some degree of that to him, just kind of seeing these representations out there, and just kind of seeing something that feels less isolating.
Yes, exactly. Hearing their stories, seeing the shows, reading about other people facing the same things, it's helped him understand that he's not alone, and that his experience isn't a solo one, that there's other people out there that are going through or have gone through the same thing. And even though the challenges of trying to find a medication that works has been unsuccessful so far, that, you know, it's going to be okay still.
So this might be kind of I'm kind of putting it together in my head right now, and it feels kind of like a weird question, but I'm not sure. He had mentioned how he feels like his tics are kind of getting worse, or he thinks they're worse than they were 6 years ago. Is that what you're observing too, or do you think that he's a little bit more sensitive to them?
No, I don't think so. I think they've actually gotten more severe.
Yeah.
More frequent. Yeah. And it fluctuates depending on stress level too, it seems.
Okay.
Yeah, just with anything with nerves, or with focus. We took him up to Flagstaff a few weeks ago, and his soon-to-be stepfather taught him how to snowboard. And I asked him at the end of the night, I said, "Did you notice you didn't tic the whole time you were out there on the slope? I didn't see any of that."
Wow, nice. Yeah.
So yeah, it just depends. But yeah, it's definitely gotten more severe, and they constantly change. There's usually a slew of them going on that are visible to me at the same time. And I know there's some other ones that he's doing, like the ab tightening or shoulder pulling, just the internal muscular twitches and tics that are done that aren't so noticeable on the outside. But yeah, the head shaking, causing his headaches and neck aches is more disruptive.
Yeah.
And if he gets upset and he's stressed or aggravated, there's an eye rolling tic where his eyes roll up to the ceiling and kind of freeze when he's trying to talk. Or sometimes it comes through as like almost a stutter where he can't get a word out or can't start speaking until he kind of gets through whatever he has to get past to get it out. That happens a lot more common. So yeah, it does seem to have gotten intensified over the years.
The snowboarding piece and just finding that thing that is sort of a tick-free zone. Have you guys found more of those? Or, I mean, it seems like that might be kind of a quest to, just kind of figure out those places where it feels good,
It was exciting. Not too many so far. And what's funny is he's not been the kid who wanted to participate in any athletics activities at all.
Yeah.
And he literally was still saying when we got up to the slope that he was just going to hang with mom. I'd had an injury recently and I was still recovering. I'd just gotten out of a walking boot. So there was no way I was going to actually go skiing with them. Mm-hmm. But I was the support, Sherpa mom, where I had to schlep all the stuff on the multiple backpacks. And he's like, no, it's cool. I'm just going to hang with mom. And then he saw everybody and we're getting in line for the gear rental. And he said, okay, I want to try. And what's funny was his little brother was the one that was super excited and gung-ho to do this the whole time.
Yeah.
And he struggled so hard. And Liam was a natural at it.
That's awesome.
He immediately was off and down the slopes. And by the afternoon, he was going up the lift with my fiance and doing the harder runs.
Yeah.
And having a blast. So
we
definitely want to encourage that. But realistically, we do live in Phoenix.
Yeah. It can't be every other day, but
it's a narrow window.
But have you seen anything else that kind of at least kind of gets at that in some variation?
Not really. I know a lot of folks have seem to have like a musical talent. A lot of you all have your creative niche, and that seems to be the piece. We tried. I encouraged instruments. I have guitars and a keyboard, and he did viola. Nothing ever really took, but he's extremely gifted in math. He's been able to do complex math problems in his head that frustrate his teachers because they want him to show the work, but he just skips over so many steps in his head before he starts to write anything down. I don't know because I'm probably usually just not around whenever he's doing a lot of the stuff in school to notice if that is a tick-free zone whenever he's focused on that.
Yeah.
But he also loves chess, and he competed on the chess team this year.
Oh, nice.
I know. I think the stress of competitions, he was ticking pretty heavily during the competitions.
Yeah.
But that's another thing where he's found, another passion that he enjoys. he definitely has those gifts. Math and science have always been his favorites.
Nice.
We've always encouraged that. And my fiance is an engineer, electronics,
Oh,
and
cool.
he's always got Liam these really, really cool age-appropriate electronic engineering kits for kids, and just encouraged that, and
Yeah.
helped encourage the math and helps encourage the studying, and that this is the career path. If this is what you want to do, these are the steps. And some of these other things that aren't so fun, you have to do that too, just to get where you want. And he's excited about the program at the high school. It's right next to an aeronautical engineering company. Like, they're next door neighbors.
Yeah.
And they partner with the high school for programs and internships and the STEM programs there. It's exciting.
Nice. So have you guys had many deep talks about high school and kind of what's ahead?
I don't know how deep. I mean, we toured and met teachers and met clubs, and got that little talk from the principal and all that. So he's
Mm-hmm.
excited.
Yeah.
I'm just glad he's excited about school for once.
That's awesome.
Yeah.
As far as the administration, teachers, principal, and all that, are they up to speed on what he deals with?
Yeah, we've had a 504 since the third grade.
Okay.
And I'm quite the advocate, I think I could say, for Liam, as far as making sure that those meetings get scheduled right away, in the time frame that they need to be, that I reach out to the teachers and um, make sure that the lines of communication are open, that they understand what his challenges are and how to help make him successful.
And for people who don't know what a 504 plan is, could you just kind of talk about it from your own experience?
Yeah, I'm not the best person to explain it, but it's an educational program where federal law dictates that the public school that we're in, has to allow certain accommodations for, I don't know if learning disabilities is the technical term, but
Mm-hmm.
certain challenges for children, and for severe ADHD and OCD sometimes comes into play, but especially the dysgraphia, the disconnect between expressing himself verbally versus written.
Yeah.
That's one of the challenges. So we have meetings at least once a year, and there's special accommodations that are written into a plan that stays in his educational folder, that all the teachers have to help him out with certain things, whether it's providing him notes or an outline in advance
Mm-hmm.
because note taking is really difficult for him, or giving extra time for taking tests. And he's also been able to do, if he can only get so much of a test down as far as the written answers go, he can go take it to a special learning center place at the school where he can take the rest of the test verbally, where they can just ask him and he can bang out the answers verbally, because that's a lot easier for him to explain the things than just to get it written down.
Yeah.
We can take that every year, and that can also follow him into college to help him. And my understanding is it also helps with scholarships, opportunities whenever he's going to college as well.
So far, do his teachers and the people who matter at the school, I'm not sure what training comes with this kind of thing. I assume there is some, but
This year was the best year so far in my experience of working with the educational team, and the 504 plan outlines it. This year had the most teachers, especially for like a junior high kind of a setup where you have all these different classes every period. They were on the page that we were on for the first time. Last year, some really got it, some didn't, and that was the struggle. Was trying to work with the ones who didn't get it, who
Yeah.
just thought, oh, if he just writes more, he'll get better at it.
Yeah.
It's not the way it works. So this was the best year yet, definitely, and they have virtually no training or experience in Tourette's. I haven't had any of them acknowledge that they really got it. So I try to give them a little 101. I know people aren't always going to read pamphlets if I give that to them, but if I just explain that, occasionally there's some vocalizings, occasionally there's some noises, Trust me, he does not want to draw attention to himself. No kid in 7th grade or 8th grade does.
Right. Yeah.
But he can't help it. And then, sometimes there's movements and he's not trying to pick on anyone. He's not trying to make faces at people if he's making a face at that time. It's just part of the tics.
Yeah.
So I try to give a little bit of an education so that they understand that, this is not something you can punish. This is not something he can control.
Right. Does he seem to feel comfortable with the arrangement overall? How would you kind of appraise his school experience?
It's, I think if you asked him, it's usually pretty negative. I mean, he doesn't love school.
Yeah.
He doesn't love going to school because of the challenges, because it's hard, because the kids are often mean, because, he has to write for some classes, and that's just a huge challenge for him. So the fact that he attended the preview at the high school and actually said he was excited about the high school was actually pretty huge for us.
Yeah.
He typically doesn't have a great school experience in it. And even though this is the best year, it doesn't mean it's great. It's still a constant struggle. It's still a constant struggle just to keep all the grades passing.
Yeah.
It really is, because there's always going to be that class that those assignments are just, they look like mountains to him. Even if they're molehills that we can tackle one by one, if we break it up, it's still challenging. So,
yeah.
The parents, the whole family, the whole village, we all have to try to encourage and keep him on task and keep it going. So it's not something that he has to take on by himself. We can't certainly do the work for him. We can't go to class with him, but we just try to advocate the best we can and try to help him out from home the best we can and try to communicate with the teachers so we can help him succeed.
Well, you said, this experience, you think it's making him stronger. He and I were kind of talking about that for a minute, about just the strength and empathy that you can have. And it may not be easier for people to relate to me, but I think it is easier for me to relate to other people and kind of what they're going through, and just the sort of breathing room and space that is, I think it's kind of a gift to be able to kind of give that to other people when they need it, versus sometimes if you don't have any challenges in life, you don't have that contrast, then it's difficult for you to really slip into a sense where you can kind of see the world through somebody else's eyes. And he's probably stronger in that respect too, I would imagine, or at least will be.
Stronger and more sensitive.
Yeah,
definitely. That's very evident. He's incredible with my friend's children with special needs. He has the utmost patience and a natural sense, a gift of how to communicate with them nonverbally. So he eases the process along, whether it's just talking to a friend that has cerebral palsy, who she loves Liam and she wants his eye contact and focus at all times, or she gets frustrated and he's trying to show her something on a page of a book or a tablet, but he's patting her knee the whole time, reassuring her that he understands that she has his full attention still. And I have several friends with children that can't communicate like everyone else does, and he's blessed with a gift to be sensitive to that. And I think the struggles that he endures, that Tourette's has gifted him, definitely makes him special in that regard.
Are there other things that you found that kind of relax you to where you don't feel like you're taking quite as much?
I like reading a lot.
Oh, nice. What do you like to read?
I read a lot of science books.
Oh, nice. Any particular? So is that more of kind of in the engineering side of science or astronomy, or?
I read physics books for fun, weirdly.
Thank you for listening. Thanks so much to Liam and to his mom, Sarah, for bringing us a perspective that this podcast didn't have enough of. Let me know your thoughts on the conversation today. Tourette'sPodcast@gmail.com to contact me, at Tourette'sPod on Twitter, Tourette's Podcast on Instagram, Tourette's Podcast discussion group on Facebook, Patreon.com/Tourettes podcast to support the show. I'm probably forgetting one or two links there, but that's good enough if you want to get involved. Speaking of which, reminder, May 15th through June 15th, Tourette Awareness Month. And I know as far as the United States goes, the Tourette Association has plans to gather in the Today Show Plaza on day one. That would be May 15th. This is where they filmed the Today Show at 6 a.m. for a very visible showing of awareness. And we'll pick back up next week when we'll be in Awareness Month. I'll talk to you then. This is Ben Brown.